So there's a couple different types of people in the world. There's the people who have gone to one dentist for their entire life, and then there's other people who have had multiple dentists throughout their life. There's positives and negatives to both of those things, but at the end of the day, you gotta go with who you're comfortable with. Now, some people move so they can't see that dentist again, and that's totally fine. But there's one big thing that a lot of people don't realize, and that's that every dentist is different. In this video, I wanna break down the differences between old school dentists versus new school dentists. So old school dentists are basically your older dentists who were taught dentistry in a very traditional way. These are your dentists who are gonna be doing things like silver amalgam fillings, maybe even just exclusively doing metal bracket braces, and doing what are called porcelain fused to metal crowns. For all the dentists who are watching, I know every situation is different, but there are dentists who exclusively use these things because they are stuck in their old ways and they have not adapted to the innovative things in dentistry. You see, so I don't have a problem with dentists who practice in the old school way, because yes, there are some incredible ways to do things, and there's so much experience that older dentists have that are super valuable. The problem lies in the fact that dentists who are stuck in their old ways and are not open to new things that are innovating in the field, that's the problem. Because if you're a patient and you're getting treatment from this type of dentist, you are getting outdated treatment. And I don't know about you, but I don't want anything that's outdated. I want things that work, and I want things that are going to be efficient and helpful. So let's start with something very simple. Silver amalgam fillings versus white composite fillings. There are dentists out there who still to this day only use silver amalgam fillings for every situation. Now, I know silver amalgam fillings have their place in specific situations, but I don't think they should be used in every situation, because composite is a very good material to work with whenever you're trying to fill cavities. Another way there's a difference between old school and new school dentists is dentists who exclusively use porcelain fused to metal crowns versus dentists who are using different types of ceramic, like zirconia, for example. You see, with advancements in materials, the newer materials tend to be more durable, they tend to be more aesthetically pleasing, and these are things that are good. Another big thing that has changed over the year is practice philosophy in terms of how conservative or aggressive a dentist can be. So there's new techniques that are called biomimetic dentistry, where dentists try to replicate the original tooth structure by using restorations like inlays and onlays. All this means is there's more and more dentists nowadays that are learning how to preserve natural tooth structure while still reinforcing the tooth and giving them restorations that they need. I personally don't know much about biomimetic dentistry. I know it exists, and I really wish that more people would teach it, because I really think the philosophy of conserving tooth structure is a really good one. Another advancement and change between old school and new school dentists is this mindset of just embracing digital dentistry. Digital dentistry is a complete game changer because it allows for more accurate and more efficient treatment options. So have you ever gone to the dentist and they took something really gooey and they put it on a tray and they shoved it in your mouth and then you were like choking on it? Yeah, that's an old school way to do an impression. The new way to do impressions is by using a digital scanner, and what the scanner does is it takes a bunch of pictures all at once and it stitches them together. It does that to create a digital representation of your teeth, and then that can be used and even printed to make models. All you have to do is open your mouth for like 2 minutes. Pretty easy, right? So one real application of this is when dentists are doing a treatment like clear aligners. If a dentist is taking old school impression molds of the teeth, they have to then send that in the mail to the lab, and then they have to take that mold, pour stone into it, and create that representation of the tooth. Then they can go ahead and proceed with making the trays. The digital way to do it, you scan the teeth in 2 minutes, you jump on the computer, you email the file, the lab takes that and they 3D print the model, and then they continue with the process. It's so much faster. This is great for everybody because nobody needs to be waiting for treatment to get done when there's an option that can speed it up. So if you're finding this valuable, please take a second and just subscribe to the channel and leave a comment below. When I see subscribers and comments go up, I get really excited and it makes me feel that I'm providing value to you guys. These videos take a lot of time and effort to make, and I really appreciate the support. When you were young and you went to the dentist, did they ever yell at you or not really explain things to you? Again, I'm not trying to generalize, but a lot of dentists in older generations didn't necessarily take their time with patients. I don't know if this was in the curriculum or what. I only know how I was taught, but basically back in the day, you have a lot of dentists that would just kind of do whatever they wanted. Focusing on patient-centered care and comfort wasn't really a priority. Dentists back in the day were just focused on delivering good treatment to patients and moving on with their day. And there's nothing wrong with that. But see, the thing is being in a dental chair as a patient can be very vulnerable. And so when somebody is not taking their time and explaining things or showing you things or keeping you involved in the conversation, it can be really scary. Not to mention, we're taking needles and drills and shoving them in your mouth. And this is something that has changed change in dental education where nowadays dentists are being trained and taught how to focus on the patient, improve the patient experience to provide more comfort. You'll kind of see this in offices where there's TVs, headphones, some type of essential oils diffuser, things that are really elevating the experience so that way you're not feeling like you're in a dental office and it feels a little bit more like a spa. So that's the direction that a lot of dentists are heading towards because they realize that the old way of how dental offices were set up is very sterile and it's not comfortable. Again, the point of this video is not to put down the way old dentists were doing things. They didn't know any better. I'm just trying to highlight how things have changed over time. Make sense? Okay, so another cool thing to talk about when it comes to old school versus new school dentistry is bracket and wire braces versus clear aligners. Both are ways to move teeth. And I'm gonna say this up front, both are great, but when you have a dentist who is solely doing bracket metal braces, they are not open-minded and they are not trying something new. Because at the end of the day, clear aligners, which are plastic trays on your teeth that move them over time, are a great treatment option for some cases. This is where old school and new school dentists have a divide. Because again, if you have a treatment option like clear aligners that work in some situations, but you only want to do metal braces because that's what you were taught and that's what you believe in, and you don't want to change and you don't want to learn something new, isn't that a problem? Because traditional braces take longer than clear aligners, and so your patients have to be in treatment for longer. They're not as comfortable, they scratch your lips, and they don't really look good. So a modern new school dentist is going to be using clear aligners to help their patients for the ones who qualify for it. And now if you're a dentist and you're watching this, I want to let you know I have created a free clear aligner training program where I walk you through everything you know on how to start doing aligners, even if you don't know anything about them. So if you're one of the closed-minded old school dentists, don't even bother. If you're open-minded and you want to learn something new, check out the link in the description below. I'd be happy to help you out. Okay, let's talk about the major shift in dentistry. Back in the day, dentists used to very much have a drill, fill, and bill mentality. Basically, they'd see a cavity, they'd fill it, and then they charge the patient for it, and then they move on with their life. Nowadays, dentists are being taught a preventative focus. So many studies over the years have been done to show that cavities in their initial stages can actually be stopped or even reversed. And so we are taught nowadays to educate the patients about hygiene and fluoride and how important it is to come into the dentist regularly so that way we can catch things before they become a bigger problem. This is all prevention-based treatment. You see, nowadays dentistry is a lot more comprehensive when it comes to the approach of a patient. Not only are we looking at your mouth for cavities, gum disease, and stuff like that, a lot of dentists nowadays are starting to connect what's going on with your mouth to the rest of your body. Because at the end of the day, your mouth is the portal to your body. So it makes sense that everything's connected. So I hope this video taught you a little bit about how dentistry has changed over the years. I wanted to share with you some of the advancements that have happened and how some dentists have adopted all the new technology and innovations and they are flying, while there are still some dentists out there who are stuck in their ways. So if you're a dentist that's watching this, I encourage you to be open to innovation. There's so many good things happening in our field. You just have to be open to trying them. Thanks for watching the video. I'll see you in the next one.